National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi there, I'm Naturopathic Doctor Jonathan Beatty, health expert here at Nationalnutrition.ca. One of the things I want to talk about today are strokes. A stroke is a very severe condition of the brain whereby there's a lack of blood to a certain area of the brain, either due to what we call an ischemic stroke or a hemorrhagic stroke. An ischemic stroke usually involves a blood clot, where the clot is preventing the normal flow of blood to an area of the brain. In a hemorrhagic stroke, it's pretty much the opposite. Instead of a clot, you've got a bleed, and that bleed is causing the blood to leak out, and that's going to be preventing the blood from reaching that area of the brain. Essentially what's happening though is a part of the brain is not getting the nourishment from the blood it needs, and that's going to lead to a variety of symptoms. So typical stroke symptoms that you may see, although they can vary widely. So if you're at all suspicious you're having a stroke, please stop this video and call 911. The first thing you ever want to do if you're ever suspicious of having a stroke is get immediate medical attention, because the earlier you get intervention, the better your likelihood is of survival, and the better the likelihood is that the stroke is going to be more minor, or that the impairments caused by the stroke will be more minor. The sooner you get medical attention, the better your outcomes are going to be. So the symptoms of the stroke can be slurred speech, it can be trouble with comprehension, it can be numbness or tingling, or loss of function of a certain area of the body. Basically, any impairment in a nerve can be a sign of a stroke. Oftentimes, people will report visual disturbances. Sometimes they'll even report strange smells. And all of these things can be evidence of a stroke or a mini stroke, which we call a transient ischemic attack. And if you do have these TIAs, or transient ischemic attacks, they're basically like precursors to stroke. So you're much more likely to develop a stroke if you do suffer from TIAs. So if you do suffer TIAs or you want to prevent strokes, some of the things you of course have to do is ensure a healthy cardiovascular system. The whole reason a stroke happens in the first place is because of an impairment in blood flow, either due to a weak blood vessel or to a clot. So what you want to do is reduce the likelihood of clotting. Easy ways to do that: supplement with things such as fish oil. Fish oil can help reduce platelet aggregation. The nice part about that is it inhibits the stickiness of the blood, but it will only do that to blood that is too sticky. The cool thing with fish oil is it won't overly thin your blood. It doesn't produce a bleeding risk the way many other blood thinners will. So it's a very safe way of doing that. You can also use a nutrient called polycosanol. Polycosanol has been well studied to show that it inhibits the stickiness of the platelets in the blood. So those are some ways to reduce the chances of having a clot and having a stroke because of that. Then for hemorrhagic stroke, you want to ensure adequate elasticity of the arteries. This is very important, and the easiest way to do that is ensure adequate intake of vitamin C, proline, and lysine, as these nutrients are required to make the collagen that provides the elasticity to the artery. By doing that, that can actually help to reduce the chances of having a stroke. Now, if you have had a stroke and you're recovering, there are things you can do to speed that recovery as well. One of the most important things to speed your stroke recovery is creatine. In fact, one study showed a single dose of creatine given within 8 hours of having a stroke reduced recovery time by up to 20%. So if it was going to take you 5 years to recover all of your functions, when given creatine, it would only take 4. So that's a very dramatic impact. As well, you might want to look into something called vinpocetine, which is a semi-synthetic extract of periwinkle, which is actually used and designed as a stroke drug in Europe. It was developed in Hungary, and it reduces the inflammation in the brain that causes a lot of the damage that occurs with a stroke. So if you've had a stroke, consider looking into and talking to your doctor about using creatine, using vinpocetine, and lastly, using something called coenzyme Q10, which increases brain energy and allows the brain to heal more effectively. So I hope you've learned something from this video that you can use in your daily life to help prevent a stroke. And if you have had a stroke, I hope some of these tips will help you recover faster and more effectively. Check out more of our natural health videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.